Naloxone Hcl Vial is used for the emergency treatment of known or suspected opioid overdose. This medication can help with symptoms such as unusual sleepiness, difficulty waking up, and breathing problems. Other symptoms of overdose may include small, pinpoint pupils, slow heartbeat, or low blood pressure. If someone has serious overdose symptoms, it is important to give naloxone right away to prevent lasting damage to the brain or death. Since symptoms of opioid overdose may return after treatment, it is important to seek medical help right away after giving the first dose of naloxone. Naloxone works by blocking the effects of the opioid in the brain. It is important to use this medication as directed by a healthcare professional and to seek medical help immediately after administering it. When using Naloxone Hcl Vial, it is typically administered through an injection into a muscle or under the skin, or into a vein by a healthcare professional. If you are using this medication at home, it's important to learn the preparation and usage instructions from your healthcare professional and the product package. Before use, visually inspect the product for any particles or discoloration, and do not use the liquid if either is present. Make sure to learn how to store and discard medical supplies safely. It's crucial for close family and household members to know the symptoms of an opioid overdose and be instructed on how to give naloxone if necessary. An opioid overdose should be treated immediately to prevent serious effects such as brain damage. The dosage of Naloxone Hcl Vial is based on the individual's medical condition and their response to treatment. The effects of Naloxone Hcl Vial are rapid but not long-lasting. After administering naloxone, it's important to seek medical help immediately, even if the person wakes up. If symptoms return after the initial injection, another naloxone injection can be given every 2 to 3 minutes. It's important to continue closely monitoring the person until emergency help is received, and to inform the healthcare professional that naloxone has been administered. When taking Naloxone Hcl Vial, it's important to remember that your doctor has prescribed it because the benefits outweigh the potential side effects. Some people may experience withdrawal symptoms suddenly after taking this medication, especially if they have been using opioids regularly. These symptoms can include body aches, fever, sweating, runny nose, diarrhea, and increased blood pressure. In babies under 4 weeks old who have been regularly receiving opioids, sudden withdrawal could be life-threatening if not treated properly. Symptoms in babies may include seizures, excessive crying, and muscle twitching. While serious allergic reactions to this medication are rare, it's important to seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you are allergic to naloxone or have any other allergies, talk to your doctor or pharmacist before using this medication. This product may contain inactive ingredients that can cause allergic reactions or other problems. Before using naloxone, inform your doctor or pharmacist about your medical history, especially if you have heart problems such as an irregular heartbeat or a previous heart attack. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It is important to note that untreated opioid overdose can harm both a pregnant woman and her unborn baby. This medication may be used during pregnancy, but it may cause opioid withdrawal in the unborn baby. Make sure to inform your doctor if you have used this medication, so you and your unborn baby can be monitored. It is not known whether this medication passes into breast milk, but it is unlikely to harm a nursing infant. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using Naloxone Hcl Vial. This medication may change how other medications work or increase the risk for serious side effects. To ensure safety, keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This can help prevent any potential negative interactions and ensure that you are using Naloxone Hcl Vial safely and effectively. Always consult with your healthcare provider for the best timing and proper dosage for your individual needs. If someone has overdosed on opioids and is experiencing serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's crucial to act quickly in these situations to ensure the individual receives the necessary medical care. Naloxone Hcl Vial can help reverse the effects of an opioid overdose and can be administered by trained individuals in emergency situations. It's important to understand the proper usage and dosage of Naloxone Hcl Vial and to have it readily available in case of an emergency. Remember that it is always best to seek immediate medical help in the event of an overdose. It's important to talk to your doctor or pharmacist about how to prevent opioid overdose. You should also educate your close family or household members about the signs and symptoms of an opioid overdose and let them know where you store this medication. This can help in case of an emergency. Naloxone Hcl Vial is used to treat a narcotic overdose in an emergency situation. It works by quickly reversing the effects of the narcotic on the body. This medication should be given as soon as possible after the overdose occurs. The vial is injected into the muscle, vein, or under the skin as directed by a healthcare professional. The dosage is based on the person's medical condition and response to treatment. It is important to follow the correct dosage and to seek immediate medical help after administering Naloxone Hcl Vial. It's important to store Naloxone Hcl Vial at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of Naloxone Hcl Vial, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.